Hi, you guys. Dr. Amber, Dr. Jessie. She's from Ribbon Rehab. Alliteration. She's from Ribbon Rehab. I'm from CHIRO for Moms. I'm going to mostly be, actually, do you mind shutting the door? Nope. We still have patients. It's still a busy day around here. Today, though, we are going over C-section recovery, the body recovery you didn't know you could have. We're going to go early postpartum C-section recovery today. Dr. Amber is lymphatics. I'm more pelvic mobility. We're not going to get into strength because, again, that's one of those things we want you to have the go-ahead from your docs and make sure that your incision is healed, without the stitching, and just make sure you're really doing a nice job to let that heal. But we will go through mobility because mobility is important because you're still taking care of a baby, you're still doing stuff. I'm going to have us focus up here. We are live on Instagram as well. So we'll be here filming. This will be on the reels later, and then of course it'll be on YouTube as well. Okay, I'm going to start, and with this, the big thing is keeping it really basic, really simple. Again, it's not about strength. We want you to wait on that. We want you to wait on the workouts, especially post C-section. You go through a lot of layers. It's a big deal. You want to be really, really mindful of the movement so that you're not tearing or pulling in ways that is unnecessary, or ways that are unnecessary, or that are going to cause more damage. So I'm going to run through 4 of my favorite maneuvers today. We'll keep it, again, really basic. If you need more structure or more instruction, our YouTube video has a few different videos, one from my Pilates instructor as well, the one that I see that I love, that I send a lot of my patients to, and then one that I actually have up there as well, and then of course our lives from the previous lives we've done. So if you want more, head to the YouTube channel to check that out, or ask us more questions. Let us know what you want to see. But again, for all intents and purposes, I'm going to run through 4, and these are going to specifically be for like that 2-week range. So those first 2 weeks, I want you to be horizontal, resting, really letting your pelvic floor heal. I mean, if I'm being honest, I would say even more time than that, but a lot of our mamas are getting antsy. They're already up taking care of their babies, so you still want to give them maneuvers to help with their low back pain, their pelvic pain. Sometimes it's front, but typically we're seeing more of the low back, even tailbone pain post-surgery, especially because your abs are not as strong and you're recovering from a C-section. So you want to be really mindful of what you're doing with your body throughout the day. And again, a lot of it is bending, twisting, lifting. So to counteract that, we're going to do what is called the standing iliopsoas stretch. So it's a standing hip flexor stretch. And I'm actually, I'm going to be standing for this one. I think my head's going to be out of it, which, do you mind just like lifting the YouTube one a little bit? Yep. So for standing iliopsoas, it's a muscle that literally starts in your groin. It attaches right in here, comes up, sits into the pelvis, and then it wraps and attaches to every low back vertebrae. So you can imagine if you're cutting through this, you're naturally going to have problems with the strength and everything you're doing back here. And again, you're bending, twisting, lifting with a baby. So what I want you to do is to counteract the flexion. You're going to put your outside leg behind. And well, we kind of talked about this, to kind of move into it slowly. You want to start here. I just move your torso. So if you were to hold in your transverse abdominal kind of muscles down below, it's not even below your C-section scar, but it's going to be the lowest portion of your abs. You kind of hold those in tightly, tuck your pelvis forward. My leg is behind. I'm already stretching my iliopsoas. From there, you can dip away from the muscle you're stretching. So if I was to show you what it looks like when I'm against the wall, it's this. I'm just dipping into it, but I like for you to hold onto the wall because you take the balance factor away. So that if for some reason it feels like it's pulling a little too much, you can lay off and just push away with your hand. From there, you take your hand and bring it up and over. And then if for some reason you need a little more, because bodies are all very, very different, you want to actually tip it backward a little bit, and you're immediately going to get movement through your spine, and it's going to cause relief. It's going to actually gap those joints and take pressure off of those nerve roots. Again, take it very slowly. this is the early phase of postpartum C-section recovery. So this is not an exercise for strength or for rebuild. This is just to keep mobility in your spine so that you don't end up in my office, right? Okay, from there, we're gonna go into cat-cow, really minimal. Not a workout, not yoga. This is just a very isolated version where you're tucking your pelvis up and under, and then you're bringing your pelvis down. So it's not this. It's keeping your spine neutral and really isolating your pelvis so that you're really not getting a lot of pull through the scar, but you're still getting a lot of mobility that's gonna help your spine and your pelvis to decrease pain, which is really important. Okay, from here, if this is feeling good to you, what I want is minimal activation through your glutes. We're gonna do some donkey kicks. Another thing you can do is activate your abductors, which are gonna be all of these out here. But for all intents and purposes, because we're just gonna go through 4 maneuvers today, I would want you here, and if your stability is there, if you're feeling good here, you slowly lift one leg, just one up, I'd say an inch. If that feels good, you very slowly lift out. So it's not a workout at all. You're holding, making sure that your spine is neutral. If this is too much, you don't do it. But again, you're counteracting the flexion. So if you're able to lift up and your spine is still neutral, you're not dipping too much through either side of your hips, then what you can do is just bring it up. And I would seriously just hold for 3 to 5 seconds, and I would bring it down. And my rule is always 3. So if that feels good and you want to try it again, do it 3 times and then be done and go to the other side. If that is not accessible to you, do not do it. Listen to your body post C-section. Way too important. Listen to your body. Okay, now you're gonna go down. Again, I'm talking spine because I'm a chiropractor. My brain is low back pain, pelvic pain. I'm trying to eliminate pain. So what you wanna do is be down on your belly, and you're gonna do what is essentially a mini cobra. But the trick here is to let your belly totally relax. So you need to let your belly go, and you just lay here for 5 to 15 seconds. What you're doing is pushing the discs back into place. So your lumbar spine, your low back spine naturally wants to be in extension. Again, with all the baby work and everything you've been through, your body has been in a ton of flexion. So we're counteracting that, we're pushing the disc back into place and taking pressure off the nerve roots, which is going to alleviate low back pain, pelvic pain, any pain that you're having. This is not an exercise. I don't want you up here. I don't want you doing it as a workout. I want you to just rest easy, and then when you come up, you make sure to really use your arms and come up evenly with both feet, where you push yourself back so that you're not straining through. And that's something to just note when you're postpartum in general, because it's gonna make a huge difference. It'll save your back, it'll save your pubic symphysis, it'll save your tailbone, because when you're doing the one-legged stuff, it just tears through this stuff. Okay, that's all I got.
Okay, so I wanna give you some lymphatic drainage focused exercises, okay? So this is just for the first 2 weeks, let's say first, okay? Now, of course, I want you walking, all right? That is because it's going to decrease your risk of getting a blood clot after a C-section. And honestly, why I love it is because there is lymphatics, right? So as you are moving around, your feet are pumping. It's gonna pump your calf muscles, and that is going to make the fluid come up. I know most of my ladies with C-section are gonna have swelling for sure in the abdominals, but a lot of you all end up getting swelling in the legs too. So really wanna focus on walking. Go to your tolerance, start small. If that's a minute, that's great. If that's 2 minutes, great as well. Just keep building. So maybe if you start off with 2 minutes and that's all you can do, then the next day try 3 minutes and just keep building from there, all right? So walking. Now we're going to the ground. Okay, another great lymphatic focused one. Breathing. All right, we've talked about that before. I really want to focus on your diaphragm because your largest lymphatic duct, it's called your thoracic duct, goes through your diaphragm. So you're going to inhale through your nose. As you're doing that, I want your stomach to rise. So you're going to inhale. As you exhale, your stomach should flatten. So inhaling through your nose, exhaling through your mouth. All right? Again, this is lymphatic focused. I am okay with you doing this immediately as long as you're feeling good. If you are breathing and that stomach is going up and it is irritating to you, don't go so far, okay? I do want you to really listen to your body like Dr. Jessie was speaking on. And if it's not tolerable, don't do it, okay? Or just do less. I'm okay with you still doing it, but do it in a smaller range. Another one while we're down on the floor. For the first 2 weeks, lymphatic focus. This is again targeting more of your legs because I know a lot of you have swollen ankles after delivering. I want you to pump your ankles. So your feet are going up and down. Honestly, I would probably do this like 20 times. And you can do this throughout the day. You can do it in sitting. You could do it in standing. Any way is fine. But first 2 weeks, I'd say these are where I want you. We really don't want you messing with any of your incisions. I don't want you messing with the tissue because it's going to take 6 weeks to heal. So first 2 weeks, very gentle. All right, 2 to 6 weeks. You probably still haven't seen your physician yet. You're going to see them most likely at 6 to 8 weeks in. I'm okay with you doing a couple of gentle exercises at this point, just like Dr. Jessie was talking about, okay? So we're going to lay back down. I'm going to make it a point here. If you are someone who cannot do things gently, you are not allowed to do this, all right? Gentle is key. I need you to really listen to your body. I need you to not push through. I'm not asking you to do strengthening. I'm not asking you to honestly even do any lengthening of this muscle tissue because it needs to heal. If you don't listen to your body at this point and you push through pain, you're going to cause yourself to go backwards in the recovery and you're going to have a longer road ahead, okay? So gentle, gentle, gentle. No pain, must be tolerable, okay? All right, with that said, we're gonna do a little bit of a small range, what I call a lower trunk rotation. So how we do this, we're gonna go knees side to side. I want you to go very slow. And again, if I'm doing this later on, I'm having people go all the way down to the ground. We are not doing that at this stage unless for some reason for you it feels okay. I do not anticipate that. So right now you're just rocking slightly to your left, coming back to the middle, and rocking slightly to the right, and coming back to the middle, and that is it. All right, so try, I like the 3 method. Try 3, and I'm okay with, I like alternating on this one, but try 3 on each side, see how it feels. If it's going okay, I'm okay with you going up to 10 each side, but if you get to, let's say 6, and that is becoming challenging, you're starting to feel your muscles quiver, you're doing too much, okay? And I want you to stop for that day. All right, you can try again the next day. All right, other than the lower trunk rotation, here when you're laying down. So again, probably starting this after 2 weeks of healing, and you're doing this until you're 6 weeks. So it's lymphatic focus. We are not strengthening, we are not lengthening. We're gonna do a little bit of a march. You are going to dive more into this in the future when we are strengthening those abs later on, and we will really dive into this. But for this point in time, just making your body move a little bit, you're gonna keep your foot on the ground. So I really just want your heels coming up, and that's all you're doing for this march. So you're lifting your knee, alternating to the other side, and relax. Lifting that knee up on your right side, so really you're just clearing the heel, and then back down. And then switching sides onto the left side, clear the heel, and relax. Okay, that is it for right now, but I do love for you guys to get, how to get up? Oh, thank you. So exercise-wise, that is it, okay? Gentle, gentle, gentle. I cannot stress that enough, but I do want to get you all moving before your first appointment, all right? Okay, the other thing I want to talk about, this is a little weird because this isn't arisen, like the surface isn't raised up, but I want to show you how to get out of bed after a C-section. So you're laying down. Now the goal of this is to preserve your abdomen because it's not going to feel great to put a lot of pressure on it. So what you're going to start with is rolling to your side. You're going to slightly bend those knees, and then if you're in bed, you can let those legs drop off of your bed, and that's going to give you a little bit of momentum to where if you push through that arm, then you'll be up, all right? And then you just stand up from here. So that way, again, you're not stressing these abdominal muscles because we want them to heal. It's really about listening to your body.
Amen, sister. By the way, I can't believe I just said that. I did. I didn't have the microphone the first time. We also didn't use the microphone properly the last time. And the time before that, we had music on baby got back on the background of the video. So I don't know, one of these days when we're doing these lives, we will get it done properly the whole time. But in the meantime, I say thank you for your grace and understanding and for being here and for participating and for asking the questions. Hope you have an amazing day. Bye.